Hello, everyone, and welcome back to our USMLE Step 1 Prep series. Today, we are joined by Dr. Russell Heckburn, one of our amazing USMLE counselors. And he's going to break down the social media question that we posed yesterday and kind of help break it down so you guys have a better understanding and prepare for your USMLE Step 1 exam.
All right. So hello everyone. I am Dr. Heckburn. Thank you for the introduction. So this week we're going to be talking about the next question, which is actually about dealing with loss. So as usual, I put a nice little comic here, just kind of dealing with loss and grief. But the reality is we all go through it, especially now during such a time that we're going through. Grief is abundant. So this question will be good for USMLE, but going forward. So let's jump into the question. So start, I'll read it out. A 60-year-old female comes to the clinic for her annual wellness exam. The patient states she has decreased energy and little desire to take part in daily activities since the passing of her husband 3 months ago. She says that her husband sometimes speaks to her. She's healthy and doesn't take any medication other than a daily multivitamin. The physician suggests that she reaches out to family and friends and become more involved in social activities. The patient responds, "What's the point? There obviously is no God, or else why would he have let my husband die? He was a good man. Why would something so terrible happen to him? What stage of grief, per the Kubler-Ross model, is this patient most likely exhibiting?" So, do you have a guess that you want to go with?
I think it's B, but I did have someone on social media comment that it was C,
Okay.
so I'm not sure.
Okay, all right, that's a good point. All right, so let's just go to the clues. So I've highlighted pretty much the pertinent clues that we will consider and go through. So decreased energy, little desire to take part in activities. Husband sometimes speaks to her. Her statement, "What's the point? There's obviously no God." Those are big clues that kind of lead to different things. But one thing to note is that she passed of her husband 3 months ago, so it is grief. It does make sense as one of these. So. Looking at these things, she's grieving, she's experienced some symptoms, but her statement is really what where the clue is. So really, what is her statement expressing? What type of mood? And it's expressing the emotion of anger. It's like, yeah, so good job. So yeah, so essentially she's angry. What's the point? There's obviously no God. Like, she's angry at this. And what happens in grief, we go through these stages actually. Just go back quickly, I actually put the stages in order from 1 to 5 from what we've ranked it. But just to know that it can go in any order. All right, so let's jump into what grief and bereavement is. So essentially, it's how we cope with loss. When we lose something, we lose someone, we get sad about it. So we grieve it, or we go through bereavement. And usually, when we're grieving, we have other emotions that come into play. We go through shock. We may feel guilty. We're sad. We might become anxious for ourselves or for others. Just bringing the fear to other people around us or loved ones. We could experience yearning, like we're longing for what we've lost. And also we can have somatic symptoms, stomach aches, headaches, inability to walk or eat for days, as you're going through the grief. There's also could be associated symptoms like auditory and visual hallucinations related to the grief. Like this patient, she says she heard her husband speaking to her. So that could be another symptom there, but that is not something we consider abnormal. There is psychosis where we hear things and it might be a delusion, but this patient is self-aware. She's well aware that her husband has passed. She knows it's a voice in her head. She may think she doesn't think he's alive. She knows that he's passed. As opposed to psychosis, they might think, oh, they're still alive somewhere and they have to find them. And also to know grief can go about 6 months average, can go up to 12 months. It can even go further, but usually it's 6 to 12 months. And as long as the patient is aware that of the situation and understands the reality that she's in or he is in, we don't really consider it pathological. It's just a normal process we go through. All right, so just to be more direct with the Kubler-Ross model. So as I said before, there's 5 stages: denial, anger, bargaining, depression, and acceptance. And you can go through these stages in any order that you want. You can bargain first and then get angry you don't get what you want. You can be depressed first and then be in denial and then accept, but then go back to anger. It can kind of go all over the place. But there's 5 stages that we as physicians kind of look out for to kind of help guide the patient through the process or try to understand where in their processing they are. So the first one is denial. So they don't accept it. They might be in shock. They may not realize what happened. or they may realize what happened but can't believe it, and no matter what you say, they can't accept it. They could be consciously or subconsciously denying it, but they just deny it. And they can create a delusion where they believe something else, but the reality is hopefully that they don't go too far into that delusion. They can be angry, like the patient that we experienced. They question faith. She was asking, why will God do this? Or she can blame someone. Someone else did it, or it's someone else's fault. You can bargain, which is negotiating with maybe God or negotiate with the universe to give yourself false hope for something else to occur. There's depression, where you just get overwhelmed, helpless, unable to really reach out. You kind of sink into a really deep state of sadness. And then there's acceptance, which is the final stage of grief, where you've accepted what happens, and not only just accept what happens, but you're making moves to kind of rejoin society. When you're grieving, you kind of want to retract and kind of be alone. So acceptance we really push for as physicians, because then you're interacting with society, just like the physician said, maybe a little premature, but he was still trying to push for that. So those are the 5 stages of grief. And, if you ever experience anyone that has grief, you can also assess and see what they're going through and see where they are, and kind of just gently, evaluate and push forward. So when you have a question, a USMLE question, what do you look for when you face potential grief? So there's other things you have to worry about, like psychosis. She had an hallucination, but did she know it was a hallucination? Is she lost in a delusion? Is she still intact with reality? She knows he's passed. She knows he's gone. She comes to get checked up. She's admitted her symptoms, so she's aware. So I wouldn't consider this patient having a psychotic episode. She's sad. She's bereaved. She has this hallucination, but she's still here. Also, personality change will come with that. She might be angry. She might be more like personality outside of normal. Maybe she's happy. That would be abnormal personality change. Then, we also have to look for depression. She didn't want to interact with others. She felt low energy. But we really have to go in and see if it's really depression, or if she's just sad and have depressive symptoms. So there's the SIGI-CAPS acronym, which is sleep, interest, guilt, energy, concentration, appetite, psychomotor, and suicidal. So we assess all those. Is sleeping increase or decrease? Is their interest level of activities change? Is she feeling guilty more than she should? Et cetera, et cetera. So we go through all those symptoms, and we try to see if any of those are abnormal. And we always look for the biggest one, which is the last one, suicide. Because someone in grief, especially if they hear a voice saying, come join me, it can be a bad thing. So we always want to look out for suicide. And then there is a state of grieving or bereavement that is a problem, or it is pathological. And that's the persistent complex bereavement disorder. So as I said, grief can go on past 12 months. But when it interferes with normal functioning, that's what that's when we're concerned, and that's when we have to push for a little bit more intervention. So if you're sad, but you still go to work, still grocery shop, you're still paying your bills, that's fine. But if you've completely regressed to where you're doing nothing at all, then that's a problem. Or you're active, but not productively active to your life, then that's a problem. So when you're doing the USMLE question, you always want to look up for psychosis, depression, and more so is the patient still functioning? If the patient still goes about their regular life, then it's most likely grief. It's nothing pathological. Just observe and just look out for the patient going forward, regular checkups, and monitor the patient going forward, making sure they're okay. All right, and so last slide, really just kind of tips and tricks for yourself, especially during this time, how to deal with, how to help someone who might be going through grief. There's been a lot of loss in the last few years, so we always want to be there where we can. So there's a lot of website resources available, counseling.org, Refuge in Grief, even reaching out to like local health facilities or mental health facilities in your community centers, hospitals. They should all be willing and ready to help out where needed. And really, if you look through the comic, just really some tips and tricks as a friend or a family member, it's really just being present and letting them know that you're there and you're there to support, and anytime they need you, you're there for them. And also, when you show that you are interested, really show that you're interested. Don't just, how are you, and walk away, because it really does go a long way. So yeah, and that's all I got for grief today.
Awesome. Thank you so much, Dr. Heckburn. Very informative. Thank you so much for also adding the slide about all the different resources. We do know that in this time, more than any time, we are all dealing with a lot of loss at the moment. So just remember that there's always someone there for you. Other than that, we will see you guys next week. We have all of our social medias linked down below. So if you want to follow along with the next USMLE Step question, just give us a big follow. Give this video a thumbs up if you enjoyed it, or if you pulled any great resources from it. Other than that, we'll see you next week.
Take care.